As a urologist, I could say that there was probably near incontinence when I heard how exciting this technology was. For the majority of patients that I see with my complex urology practice, traditional antimicrobial culture testing and sensitivity has just failed to show me what I need.
But there were certainly a lot of times that we were pretty convinced somebody had some type of infection in their bladder and the tests were coming up negative.
You'd know they were infected, or you'd think they were infected, and you'd treat them as if they were infected, but you didn't have the evidence to back it up.
So as a result, all we have available is just antibiotics. So we can presume it's infection, and here's some antibiotics.
Sometimes 10, 15 rounds of antibiotics, usually one after the other.
And you can imagine some woman who's come here already, who's been treated with 3 or 4 different antibiotics, who's frustrated because she's had this for months at a time. They want a diagnosis accurately, they want it fast, and they want to get treated quickly.
And the chronic patient for whom there have been no other answers and multiple referrals by different doctors, that's a critical aspect of the next-gen sequencing.
I had a patient show up to me from his primary care doctor with results from the MicroGen test. And I looked at it and I had no idea what it was. I made a phone call because I thought this is revolutionary.
If somebody's having a lot of symptoms and they're really uncomfortable, then we will go ahead and start treatment just based on the PCR.
The PCR is nice and fast, so if that is positive and it's clear and there is a sensitivity, I will start with that. But sometimes I will still wait for the MicroGen because sometimes they'll pick up other bacteria that the PCR didn't.
There are some unusual bacteria that sometimes happen that you don't expect, that initially you don't get it on PCR.
If there are mutations, it may show up negative. So there have been a handful of cases where the PCR for what I'm testing for shows up negative, but it still shows up as the predominant organism on the genetic testing.
Once the sequencing is done, it's much more accurate and much more precise.
You're checking your PCRs on the standard things that you think you might find, but then the next-gen sequencing just gives you the answer. It's almost like cheating.
I was a little skeptical at first to see what this would bring, and what I was surprised so quickly after starting the therapy was not how many negatives there were, but how many positives there were. In fact, how few negatives there were.
Small microorganisms that I didn't even think about, that I didn't even know about.
You're picking up on some things that maybe you've never heard of. I will look up the organisms, try to get some data about them, see if they've ever been found in the urinary tract or the genital tract.
The next-gen sequencing doesn't care what you order. It looks at all the DNA and says, here's what you have. It compares it to a huge panel of bacteria and fungus and says, this is what we found from a DNA standpoint. This is what's there.
As far as figuring out the correct antibiotic for the patient, it's like a key and a lock. You have to have an appropriate antibiotic for the specific organism that you have. The advantage to MicroGen is that it gives us the right key.
You can see that, okay, this made a difference. This really found what was there and treated it.
I definitely have had a good number of patients who have shown improvement when we finally found something to treat.
You know, they just sort of like roll their eyes when they've been 6 months without an infection. They're waiting for the next wave to hit them. And guess what? The next wave hasn't hit them.
With this test, you get to be the hero a lot of times. Now we come in and we say, look, this is what you have.
MicroGen and your company is the best thing that's happened in this space and as long as I've been in my career. You need to know about this technology and you need to know about it yesterday. I talk to my colleagues about MicroGen. I say, this has revolutionized my practice. It will revolutionize your practice.